Hi, I'm Ryan Hunter, and this is Kalispell Connections, a program where we talk about issues important to the community. And with me today is Jane Emmert and Tammy Harmon, both with the ASSIST program. Hi, Jane and Tammy.
Hi.
Hi.
So can we start, I think a lot of folks may not be familiar with what you do with the ASSIST program. Can you talk about what it is you do and the service you provide to the community?
So ASSIST is a nonprofit that was the brainchild of Kurt Lund. And Kurt was a CASA volunteer, which is very intense volunteering for kids in the foster care system. And he got on the board at Kalispell Regional Hospital and heard about people falling through the cracks. And because he had been an intense volunteer, he said, we could solve this problem with volunteers. And nobody believed him. So he hired me and paid for all of the expenses for almost 2 years to get ASSIST up and running. And what we do is we take referrals from medical entities, and they're concerned about someone who's falling through the cracks. And we have a staff and a volunteer who go and visit that couple or family in their home to try to sit and listen to what their real need is. So it's simple example is the doctor's worried because Mr. Smith isn't taking his medications. When we get there and we sit and we visit with him, we find out he doesn't have a winter coat for his daughter and he's worried that his energy is going to be shut off. So we help him apply for a low-income energy assistance program. We connect him with an organization that provides jackets, and we have helped solve a problem that will improve his health down the road. And then over the years, we added transportation. So we have multiple vans that give people rides to doctor's appointments. And we concentrate on people who are very rural. They live outside the Eagle Transit target area primarily. And then we are very specific. We only take them to doctor's appointments.
And so you are affiliated with the hospital. This is a hospital program, is that correct? Or are you your own nonprofit organization?
We're our own nonprofit, but we actually are affiliated with Kalispell Regional Medical Center. They subsidize us heavily along with grants.
And the information about the clients that you're working with, is that coming from the doctors that you work at the hospital system? They're the referrals, or how are you connecting with these individuals?
It does come from medical teams. Somebody that is concerned about what at that time is a patient and says they need help with what we call social determinants of health. We're non-medical, but there's a lot of things that impact a person that aren't medical. They don't have a ride to a doctor. They don't know how to go through a phone tree to find assistance. They don't know how to fill out paperwork. And so we help bridge those gaps. And we are connectors. That's our purpose. I joke that we don't do anything. We connect people to existing resources.
Yeah, it reminds me a lot of the education system and also the criminal justice system, where they find, kids that are struggling. If you dive deeper and you look at, okay, what are the issues here? It's all sorts of issues that aren't tied to the school system and education directly. And if you can address some of those background issues, you really assist the students and the education goals. And it sounds like it's very similar with healthcare as well. Could you tell me, obviously, all these organizations in the Valley are coping with COVID and the new realities of the pandemic. Hopefully we're through this soon, but how has the pandemic affected your work?
So when Jane mentioned that we go into the home to listen and get them connected, we have not been able to do that during the pandemic. We are doing our interventions primarily over the phone and through the mail. Many of the programs or services that we try to connect with have online applications. So that has actually been quite a benefit for us during COVID. Transportation has been affected minimally. We're not able to transport more than one person at a time. So it has slowed down the transportation a little bit. But the big change is not being able to visit in the homes.
Feel that you're losing some of those contacts with your clients that would otherwise happen? Is there a fear there that some more are falling through the cracks as a result?
I'm not sure that more people would fall through the cracks. We have definitely lost that ability to be the eyes in the home for a doctor's office. And many times that is one of the biggest benefits of Assist, is that because we were in the homes, we're able to identify when someone has a less than ideal living situation, maybe safety hazards with rugs and things that could be trip hazards, or problems like that, that we don't see those now the way that we used to.
So you're seeing these folks a lot post-treatment, and I imagine you see all sorts of types of situations, and it sounds like you're just there to kind of troubleshoot anything that pops up, and in terms of that barrier to them succeeding in their recovery. But what would you say in your experience is the biggest barrier for folks in succeeding in their recovery from treatment and getting healthy?
So I think there are three primary reasons for referral that we help with. Housing is huge because we have, a high cost and limited availability. Many of the people that we work with either have no housing or they struggle to maintain their affordable housing. Health coverage is huge. Many times people are not insured or underinsured and they need help to access Medicaid. And that has been compounded by the fact that the offices of public assistance are closed to the public. And you can really only apply online or over the phone, and using that phone tree or the long wait times interfere with a person's ability to apply for Medicaid and understand the requirements and documentation that's required. And then we also help often when people need to apply for a disability benefit, usually with Social Security, sometimes with the VA. A person that has been healthy, active, employed, suddenly gets a traumatic diagnosis or suffered an extreme accident and can't work, may be in a position where they need help to apply for those benefits. I think those are the big three that come to mind.
And Ryan, most of us don't even think about how difficult those applications are. And I mean, when's the last time you looked for housing, or me? We have our homes and we don't think about, and the applications are long and they have to know their last 5 rentals and the landlord's name. And a lot of the people we help don't have that. And so helping them slog through the paperwork is a huge, huge part of what we do. And I never really liked paperwork. But once I saw the impact it had on people's lives, it made a difference for me. And I often say that our volunteers, they get paid in hugs and the gratitude of people who just can't navigate a difficult system.
Yeah, no, and I keep hearing over and over again the housing crisis that we have in this community, and it's such a huge need. Or hopefully we'll work to improve that in the coming years. But absolutely, I'm curious, as you mentioned Medicaid too. Obviously, that was expanded a few years back. More folks could be eligible and get on. Have you seen a big impact on that locally with the expansion of Medicaid?
There are certainly a lot of people in our area that have benefited from the expanded eligibility. I don't have numbers, but just a lifesaver for many people.
So I know you rely a lot on volunteers with your work. If folks were interested in getting involved in the program and helping out, what's the best way for folks to volunteer and get involved?
So Assist has a website. It's assistflathead.org. And there's a tab for volunteer and a little application form. If they fill that out, I will be in touch with them and visit with them a little bit about what their interests are, what their skill set might be, to identify whether or not we might have a position for them. Certainly one of the things that we're doing often now is an online application, whether it's housing, disability, Medicaid, many of those things require an online application. So we certainly appreciate volunteers that have computer skills. They don't have to be experts, but at least not be afraid of a computer.
And we do intensive training with them, so it doesn't have to be, oh, I already know how to do that. The other beautiful thing about our website, Ryan, is that if people are looking for answers, we have a lot of community resources on there. And the best example is if your mom needs to go into assisted living, you can go on the Assist website and get local options with a direct link to those organizations. Because sometimes when I do Google, I'm getting strange and wonderful organizations that are trying to make money if I click on them. So anyway, we tried to make that easy for people looking for simple answers.
Well, I will keep that in mind because I will be possibly moving my mom locally to assisted living and this year. So that will be a helpful resource for me as well. Yeah, no, I mean, what a great way to help out in the community. And I imagine it's a great way to meet some of our fellow community members. You know, when you're helping folks out, you get the chance to help wonderful people and make new friends and just be a bigger part of the community. So you can't, I got a cat jumping all over me. I apologize. You can't beat that. And that's great. So thank you both for the work you do and for Assist. You know, I've heard about the work you've been doing in the community, and I know it's critical and important, and a lot of people benefit from it. So thank you very much.
Thank you,
Thank
Ryan.
you.
Bye-bye.